With tools like beakers and Bunsen burners and microscopes, our next rewarding career opportunity in healthcare takes the skills of a research scientist. The work can vary for someone who works in laboratory services. The team from Nemaha Valley Community Hospital goes into the lab to share the career options available in a medical lab.
Everything in the laboratory begins with collection, whether it be blood, urine, or bodily fluids. Proper specimen collection is a crucial step to ensuring accurate results. As a phlebotomist, we collect blood specimens from newborns to end-of-life patients and every age in between. We take care to collect our specimens in the right tubes to ensure you get the right results.
In hematology, we study the white blood cells, red blood cells, and platelets to determine your overall immune system health. We can tell by just looking at your cells under the microscope whether you are fighting an infection, suffering from anemia, or possibly have leukemia.
Chemistry is the largest department of the hospital laboratory. It includes tests that cover almost all the organ systems and processes of the body. Suffering from an unknown autoimmune disorder? I can help you discover it. Trying to manage your diabetes? I can help you watch your numbers. Struggling with fertility issues? I'll be there every step of the way, helping you get pregnant, monitoring your pregnancy, and supporting you and your baby after delivery.
If you need blood, I'm there to help you find your perfect match. Blood bank is more than just ABO and RH factor. We type and screen to ensure a safe transfusion. After an accident or suffering the effects of chemotherapy, we're there to help boost you up during that traumatic time in your life.
Coagulation looks at a complex series of reactions to see if a patient can make a clot. We monitor your warfarin dosage or make sure you are safe to undergo major surgery. We also are essential to determine whether you are possibly suffering from a stroke or blood clot.
Microbiologists work at identifying the smallest organisms, whether it's a virus or bacteria, to determine what is making you ill, and more importantly, if there's a way that we can treat it. Knowing the difference between a virus and a bacteria infection is crucial to controlling the spread of antibiotic resistance. We collected and tested respiratory pathogens over the past few years and are always looking for new ways to combat and control the next epidemic. Medical laboratory scientists are detectives. We take all the pieces of the puzzles from the different departments and put them together to get your whole picture. In a small critical access hospital laboratory, we work in all the departments in the outpatient and inpatient setting. In larger hospital systems, medtechs are allowed to specialize in one specific area. Laboratory results account for 70% of all medical decisions and help diagnose and treat you. Whether you choose to pursue a 4-year degree in clinical laboratory science or a 2-year program for the medical laboratory technician, you will make a difference in your patients' lives. Medical laboratory science is the science behind medicine, and we are a crucial member of the healthcare team.
I want to welcome our panel of one to talk to us today about the laboratory services. To answer your questions about the different career opportunities, I want to introduce Kate Bowerly. She is the laboratory director and a medical lab scientist at the Nemaha Valley Community Hospital. Welcome to our career day, Kate.
Hello.
Well, we do have questions already from students for you, but first, tell us a little bit more about the different jobs in a medical lab. And then also, are these jobs just limited to a hospital?
No, that's one of the more interesting things about this job is that it's based in science. So you, in your undergrad, do chemistry and physics and biology, and all of these undergrad disciplines allow you to, if you decide later on not to want to be specifically in a hospital setting, there are a lot of other opportunities that are available to you. So I prefer the patient interaction. And so I do work at a critical access hospital, but I have classmates of mine that have gone on to do research at like cancer facilities that are looking for developing new treatments or some of those specialized treatments where they take your specific cells and they turn them on in a specific way in order for you to be able to fight your cancer. I have friends that do traveling techs and they go to different facilities and help do installations of new pieces of equipment and train the staff there. And then there also is administrative work that you can do. So several of my colleagues have gone on to do infection prevention. A large portion of that job is understanding cultures and sensitivities and all of those kind of things. So they work with the nursing counterpoints to have and form an infection prevention plan at their hospitals.
Jaron, you have some questions from our students?
Yes, you bet, Shireen. So we've got a couple that have already started coming in. And so if you have other questions, keep those coming. But so Tammy asks, what are some of the most common laboratory tests you perform? And we'll start with this one, then we'll have a couple others, but we'll start with that.
Okay. The most common labs that we do generally are on blood work and generally are a CBC and comp. So we use a lot of jargon in the laboratory field because there's a lot of long scientific names. And so a CBC is a complete blood count. That's basically looking at your immune system. So it's your white count, your red count, your hemoglobin, hematocrit, what your differential breakdown is. And so those are the specific cells for like fighting infections, fighting viruses. And what that generally tells us is how healthy are you? And then a comp, which is a comprehensive metabolic panel, that's looking at specific chemistry tests that are for your liver function, your kidney function, general electrolytes to see how those are working, and then just looking at kind of your whole body picture to see what is going on. So pretty much if you've ever had lab work done, I guarantee you've had those two lab tests done.
Well, that's good to know. Yeah, I bet that does impact everybody. So Drew asked the question, what is the rarest illness you've come across during your work in the laboratory?
So I have a lot of friends that work at much larger hospitals. And so every once in a while we'll get together and, PHI, so we don't talk about specific patients, but we've seen very kind of interesting things. But I myself, the rarest thing that I came across was a hairy cell leukemia. Kind of sounds funny. It literally, when you look at it underneath the slide, it's a subtype of chronic lymphocytic leukemia. So there's a specific lymph cell we're looking at. But in hairy cell lymphocytic leukemia, what we see is the cells literally have like these hairy projections around. There's only about 2,000 cases in the United States, so it is really pretty rare, actually 2,000 cases in the world. And so it was one of those moments too, where this patient had been very fatigued, very tired for 6 months. They didn't really know what was going on. They had a lot going on in their personal life, so they thought they were just getting run down. And it was, no, you have leukemia. And actually, I was the one who found it. proceeded to tell the doctor that information. Then it did go off to pathology for confirmation, but I could tell immediately by the cells that I was looking at that that's exactly what it was. So.
Well, that's really, yeah, that is very interesting. And you can, I'm sure, there's no typical day. You never know what you might see there on some of those tests.
And
so
it's very interesting too, because sometimes you think something's going to be completely normal. You know, this patient really logistically thought they had the flu. They just thought that they had been run down for a couple of weeks, and then all of a sudden they were getting sick. And it was because their leukemia had reached a certain point where their body was no longer able to fight off any kind of infection.
Next, Jill asked the question, what is one tip someone told you before you started working in the lab?
When I was going through school, we do phlebotomy. So there were medical assistants that talked about it a little bit. Some of the nursing, they'll also do some collection. It just depends on the facility that you're at. But when we were going through our clinicals, we had to practice on each other. And I remember one of the other students that was with me had been working as a phlebotomist because, well, he had been. And he told me that phlebotomy is 90% confidence, because especially starting out, you don't want to tell your patient, hey, you're like my third person to stick. You just have to go in there. You got to go in there with confidence. And that's something I will tell my new employees or tell any students or anyone that I interact with, because it really is. There's a skill set that's involved that you have to master, but half the time just pushing through and knowing that you can do it really can help you accomplish a lot of things.
That's cool. Okay, so Hannah now asks, so you mentioned in your video there's a 2-year program that you can do for some occupations. There's that 4-year. And so with a lot of that, don't have to share your salary, but Hannah asks, well, how much do you make? Or maybe is there a range to kind of get an idea of, what are some of the options that as you have these different types of careers, if you're familiar with that, what are maybe something that a student could expect?
So the biggest thing about this career is that there are so many job opportunities. I have a universal license. So I have a degree in clinical laboratory science, but I am a medical laboratory scientist. We're big on acronyms. So my salary here in the Midwest is less than some of my friends who have moved to the coast. Cost of living and other things are expensive. So it really depends. Starting out base salary is usually in that $20 to $30 an hour range. And that's with no experience, fresh out of school, a fresh grad with the MLS level, the 4-year degree. But then it rapidly goes up from there. And that's just for our area. If you were working at a larger hospital, they would probably have a higher, ours is different differentials and things. But that's kind of a base salary. And then you can move up from there. I obviously am a tech with 10 years of experience and I'm in administration. So mine's a lot higher than that base salary to start off with. But as you gain skills, or if you work in more specialized facilities or specialized testing, that can go up from there.
Okay, that's really good to know. And so Joe asks as well, so, as a high school student, what are maybe some classes your students should think about taking as they're looking at, maybe there's dual credit classes or maybe just good science classes that you should take in high school to prepare yourself for a laboratory career?
So if you remember in the video, I kind of touched on this, that we do about 70 to 80% of the actual diagnostic work for medicine. So we're the science behind the medicine. We're how your doctor figures out what is actually going on in your body. So I would recommend taking strong science classes, but you also need those medical terminology, those medical technology kind of classes. It's also good to take some of those gen eds and things to get out of the way so that when you go into any kind of college field, your science classes are going to be very intensive and most of them come with labs. So it kind of can limit sometimes your schedule because you have to take the course portion and then the lab portion at a different time on a different day. So just knocking out some of those gen ed lab or general education courses so that when you get to your college level classes, you have time to invest in those really important high science classes.
And one last question, and this is for me, I think, instead of just a student, but I'll throw in the last question. We have all these students on the event today. what is advice that you would give to a student as they maybe consider or are maybe pursuing a career in lab?
The biggest thing is to keep your eyes open. Lab is one of those careers that no one knows about. We're kind of behind the scenes. We're not necessarily known for being the most outgoing, extroverted patient interactions that you're going to see. Most people think that doctors do our jobs or nurses do our jobs, and we don't. So it's getting in there and realizing that this career can be what you want it to be. I want that patient interaction. That's something that I highly value. I came from a small town. I now live in a small town. These patients are mine just as much as they are the nurses, just as much as they are the doctors. I'm watching them. I'm monitoring them through it. The nice thing for me is that I'm a step back. So they are my patients. I can take care of them. I can monitor them. I can help them through whatever they're going through. But I don't have to take it home, because when that patient had hairy cell leukemia, I could find that for them and I helped them through that chemotherapy journey. But I wasn't the one who had to tell them that they had that. I wasn't the one that, when treatment stopped working, that had to give that information on. That allows me the ability to step back and still have that empathy, still have that patient interaction, and still give the answers and solve the problems, but not have to deal with all of the ramifications that are different parts of healthcare. Also, if you love science, this is the career for you. We get to play with new things every day. We get to see new patients every day. And so each patient is new, each patient is individual, and all of them are important. These are your siblings, these are your parents, these are your grandparents. And so we get to help each individual case and do it to the best of our abilities.
Thank you, Kate, for joining us this morning and sharing your insight on a career and working in a medical laboratory. It sounds very fascinating, and just thank you for spending your morning with us.